Hi, I'm Vivian from Singapore. Yeah. Before I start, perhaps I can just take a few minutes to introduce our school. We are from NUS, National University of Singapore. We are considered as a very young faculty, started in 2005. Currently, we serve about 1,004 students, which covers undergrad to all the way to postgrad program. And in addition, we also provide continuing education training program for working nurses. So we are ranked as number 20 in the recent QS World University ranking. We are proud of our achievement. Yeah, so for the research programs, currently we have 5 major teams from chronic illness, which is led by Prof. Wong WU, women and children care, led by Prof. He Honggu, patient safety and quality of care, that is led by Prof. Liao, who is our head of department, and also education innovation by Prof. Lydia Lau. Yeah, so I serve as a chair for geriatric and wellness program. Yeah. We have 7 faculties who has been named as the world's top 2% most scientists. We are proud of our achievement. Yeah. Okay, so now I'll move on to the study, which is the community-based e-health program. I think we are all fully aware about the aging population, so I'll not go in depth about the literature review. So basically, just a very brief background. Majority of our older adults, they are living in the community setting, and the prevalence of chronic conditions such as hypertension, hyperlipidemia, and diabetes has been high among this older population. Now, in the past, we are very driven in delivering health education program, which are mainly done by healthcare professionals through face-to-face method. However, in the past 3 years, because of COVID, we realized that such resource-intensive method may not be sustainable anymore. And with the recent development on technology, we would like to tap on such resources as well. For example, delivering the program through the e-health platform to improve or enhance the health literacy. And at the same time, we hope to empower our older adults to better self-manage their chronic conditions. Yeah, so this is the conceptual framework which guided the entire study. And you could see that on the left-hand side, and these are mainly the risk and protective factors. And some are non-modifiable, such as our age, gender. And of course, we can modify certain factors like, social networking, community, and hopefully we can provide better support to our older adults in terms of, to achieve better health outcomes, such as, better self-control in terms of their health condition, higher quality of life, reduced morbidity or mortality, or, increase their awareness on what are the available resources that's, in the community, which they can utilize. Yeah, so we actually applied formative design when we developed the e-health intervention. So in phase 1, we actually went through quite a lot of groundwork. So we did a scoping review and followed by cross-sectional study and a focus group discussion as well. So with these resources, that actually help us to identify the needs of older adults regarding e-health. Yeah, so with that, we identify the initial design ideas and then further develop the preliminary program. Yeah, so once the program is ready, we then, proceed with client-centered, trial. And then with the feedback we have collected from the older adults, we then, work on the revision and refinement of the program. Yeah, so this is the scoping review, which we look into the psychological impact and online interventions of social isolation. So this was actually done during COVID pandemic. Yeah, so it was published at JAN. So many, we could see that really there's negative impacts on the older adults during social isolation. It's not just affecting their physical health, but it's affecting their mental health and well-being as well. Yeah, but throughout the process, older adults, they are trying to adopt coping behavior, in the process of COVID, either through self-help or external support to overcome the negative impacts of social isolation. And they started to kind of learn to cherish life, and they are more, acceptance towards death, the loss of their friends, their family. Yeah. And they are actively seeking the support from online interventions, such as, telehealth solutions, which are provided for medical services like, teleconsult, and certain online home-based physical activity program as well. However, while they are trying or exploring these online interventions, they are encounter barriers, situation like lacking of access to technology, or their own lacking of proficiency in using such technology. And there are some, different attitudes across the older population. Certain groups of older adults are more positive or welcoming towards the use of online support, whereas another group of older adults are more cautious because, they are being trained, or they have unpleasant experiences of encounter scam calls. They're concerned about people could cheat their money over the internet. Yeah. So then we proceed with a cross-sectional study to understand the various factors which may impact on self-care. Yeah, so this was done over 208 older adults. Yeah, and it is clearly evident through the past analysis that, cognition, sense of coherence will then impact on, our health practice, which then impact on the ability of self-care. Yeah. So, and these are important factors that, we need to put into consideration when we design the e-health program. Yeah. So, and then in addition to that, we conducted 4 focus group with about 20 older adults to understand, what are their needs, what do they want about the e-health program. Yeah. So we could see that, 3 major themes emerged from the discussion, and many, they are building self-efficacy actively in living or managing their chronic conditions. In a way, they are complying with the medical treatment. They are more mindful about their dietary habits, such as they are aware about, they should eat less salty food, less sugar, or less oily food. Yeah. And they are constantly practice emotional regulation to engage themselves in social activities among their peers. Yeah. So throughout the process of navigating the health-related information, they do encounter challenges like, most of them could have limited digital literacy. And, and also when they are obtaining information from the internet, and some of them are not very clear about whether this piece of information are reliable or not. Yeah. So, however, the learning needs about e-health are constantly evolving. And while the elderly share that, they don't mind trying to use technology, but they preferred more tailor-made program for them rather than one for all kind of program. And they enjoy group-based session whereby they can, interact with the peers, with their own peers. Yeah. And, from the discussion, it is clearly, delivered to us that the elderly attention span is short. So we dropped ideas of developing brochures, reading materials for them. So then, but 2 to 3 minutes of short videos could probably catch their attention, and at the same time deliver the health information as well. So we then, develop 20 over videos which cover a wide range of topics from exercise to mindfulness to management of chronic conditions, and medication adherence to brain health as well. Yeah, so once the first draft of the contents are developed, we actually formed a content expert panel of 7, including nurse clinicians, geriatric physicians, physiotherapists, dietitian, and pharmacists. So we invite them to read the content of the program. And after we went through 2 rounds of content validity testing, we modify certain contents based on the experts' feedback. So we managed to achieve the skill level of content validity of index of 1, and that actually give us the confidence that the program, is appropriate, comprehensive, and relevant as well. Yeah, so this is the overall picture of community-based e-health program. Of course, it delivers health education, it provides monitoring and alert advisory services, and diet and lifestyle as well. Yeah. And while we are, building the program, we have also developed a mobile apps. We call it Care for Senior app. Yeah, so if the we will teach the seniors how to use the apps. Once they log in, this is the main page, and they can log into the daily care session, which allows them to enter their blood pressure reading and glucose reading as well. So if the reading is normal, it will appear in red color, and if it's too high or too low, it will then appear in red, and there will be a message sending to the senior, to the elderly, to remind them that you should probably check your BP again, or get advise them to see a community nurse or their GP. Okay, and in the exercise portion, they can follow the instructional videos to do exercise at home. And this portion is especially helpful during COVID period, whereby the elderly are advised to stay at home because they are highly vulnerable population. Yeah. In the quiz portion, the apps will actually push out 3 short questions every day, and these quiz questions are all related to the contents in the health library. Yeah. So, and each time they answer the question correctly, they will score 1 point. So in a way, it's a way of motivating them to watch more video, to get more health related information. Yeah. And the profile page basically indicate their BMI, height and weight, and so on. Yeah, so we actually created a storyboard with a elderly couple, Mr. Tan and Mrs. Tan. So both of them are having some chronic conditions, and it's basically a series of story happening between this elderly couple. I have a short video here.
Hey, why do you look so distressed?
I just talked to the community nurse, and he said my diabetic condition is getting worse. I've been experiencing tingling sensations in my limbs, especially my foot. The nurse told me it's likely neuropathy, the damage of a nerve, and it's common in patients with uncontrolled diabetes.
Have you been monitoring your blood sugar level regularly? And have you been taking your medication on time? Neuropathy is not the only complication you might experience when your diabetic condition worsens. The doctor said that you may develop a diabetic eye, foot, kidney failure, and even cognitive decline. I think the worst is if you develop heart complications.
Yes, indeed. I'm afraid my diabetes will become that severe.
Don't worry. I can tell that you have been exercising and eating healthier lately. I will support you in eating a healthier diet and will exercise with you.
Yes, I will pay more attention to my health from now on. I will eat less sugar and carbohydrates and aim to exercise for at least 2.5 hours a week. Hopefully, I can lose weight too, which will prevent my condition from deteriorating faster. I'm going to measure my blood sugar level now.
Hey,
All right, so this is one sample of the video, right? Yeah, so when we then discuss about how should we deliver the intervention, so then we consider the findings from the focus group discussion again. Yeah, remember the elderly shared that, they don't mind to have to try technology, but they also prefer, certain kinds of human interaction. So we deliver the program through a blended mode with face-to-face group session, e-health platform, and virtual follow-up through the mobile apps as well. Excuse me. Yeah, so the program was delivered over 12-week session. 7 weeks we meet the elderly face-to-face, and the remaining 5 weeks we use the mobile apps to reach out to them. Yeah, so every session we have a focused topic. Yeah. For example, management of hypertension, healthy diet, and so on. So at the beginning of every session, we get them to do some physical exercise, and then end of every session, we get them to do mindfulness practice as well. So that will help them to learn how to relax. Yeah. So we cover topics such as cognitive impairment, and then some brain health games to keep them engaged and train their memory as well. Yeah, so these are the recruitment criteria. And outcome measures, besides the clinical measures, we also look into cognition, self-care ability, healthy aging practice, and of course the literacy and social support as well. Yeah, so these are the pictures taken during the program. So as mentioned just now that initially we get them to do sitting on the chair kind of exercise, and once they are more stabilized, we get them to stand up, and we increase the intensity of the exercise. Yeah, and this is when we deliver the health education part. So in the first few sessions, we actually spend more time to teach them how to use the mobile apps. For example, how to key in their blood pressure and glucose reading, and so on. Yeah. And what's interesting is that, while we are conducting the session, we actually observe there's a lot of peer teaching, peer learning happening as well. Because, some seniors are more capable in using technology. So they will teach those who have less exposure with technology. Yeah, then the last 5 minutes we used to get them to do some mindfulness practice using guided imaginary. Right, so this is the flow chart just to show the pilot testing. We have published this feasibility study, and basically it's showing positive changes towards self-care ability, and there's downwarding trend towards the glucose and cholesterol management as well. And in addition to that, we have collected user feedback on how is their user experience in the mobile apps, and mostly they feel it's pretty easy to navigate, and appreciate the quality of information delivered through the mobile apps. Yeah, what they enjoy most is the exercise video, which they can follow and practice at home. They like the health record, which allow them to to observe the trends of their BP or glucose from past 1 week all the way to past 90 days. And we actually encourage them to bring that record to where they go for their GP follow-up appointment. And they enjoy the elderly couple, the Mr. Tan and Mrs. Tan, and how is their conversation in the video as well. Of course, they also highlighted certain technical issues which we have worked with the tech team to actively address those. Yeah, so with that feasibility study actually give us the confidence that the program is feasible, and then we can continue with the cluster control trial. Yeah, so we deliver this over about almost a 2-year period. Yeah, and it was conducted over 11 senior activity centers, 6 serve as experimental cluster, and 5 as control cluster. So both actually went through the pre-test and then post-test 1 and a follow-up in 6 months' time. And we also invited those in the intervention group to for a follow-up process evaluation, mainly to understand how is their experiences after the program. Yeah, so these are the social demographic information. Perhaps let me just highlight this part, and you could see that more than 50% of them are actually having more than 2 kind of chronic conditions. Yeah, so that's really concerning. Yeah. And and the results actually show that there is significant changes in terms of their health literacy level. There is improvement. There is improvement in terms of their self-care ability, especially in the monitoring sub-skill. Yeah, and there are positive changes in terms of the cognition, which is reflected by MOCA and SDMT as well. Yeah, so in a way that we through this project we create an opportunity to extend the evidence-based community e-health program, and that actually extend the potential to enlarge this program even at national or international level. Yeah, and through this program we really empower our community dwelling seniors to lead a more meaningful and fulfilled lives with the use of technology. And in fact, I really appreciate the strong partnership that we have built with our community partners in the past 3 to 4 years working with them on this project. Yeah. Yeah, so probably I'll just share a bit more on our ongoing projects from our geriatric research group. So, with the foundational work that we have done in the e-health project, right? We actually secured a larger national grant to work on the precision care pathway through variety cognitive assessment among the older adults, and we plan to identify those at high risk and then engage them with active intervention. Consists of the mobile apps and intensive aerobic resistance training with brain health program as well. Yeah, so while we are actually working with this group of older adults, we realize that there's another group of elderly caregivers. Yeah, so they are aging and they are also taking over the caregiver role, looking after their partner who are having chronic illness. So this group are often overlooked. So we realize that there's gaps there, and we are actually working actively with community partners to develop a resilient coping program to support our elderly caregivers as well. Yeah. And also, while we are, we have also been working on programs, not just, looking at older population, but from middle age onwards, because, the prevalence of cognitive impairment, especially MCI, has been quite alarming, among the T2DM population. Yeah, so we are actually actively looking into healthy longevity interventions to engage this group of middle age to older adults with T2DM, and hopefully to identify early signs of MCI and get them into early intervention as well. Yeah. And also the newest project we are starting to work on is the targeting on the transition period for the older cancer survivors, because once they are discharged from the hospital, they are no longer on active chemo or radiation therapy, and but at the same time they are advised to stay at home because they are highly vulnerable population. So very often after 6 months to a year, this group become very socially isolated, and they feel lonely. So again, we are working with oncologists and the community partners to see that how we can better support this group of older adults as well. Yeah. Yeah, I would like to acknowledge Changi General Hospital and Senior Activity Centers for supporting the e-health project. Yeah, and thank you. And of course, welcome to Singapore. Yeah, and then we have a Sigma conference and also an NEP conference. Yeah, coming up in July and October. Yeah, so hope to see you all in Singapore. Thank you very much.